we're inching towards that 500,000 mark for cases here in the U.S. I want to head out to Anjalee Khemlani with the very latest on that front. Anjalee, there's been a lot made about some of these communities that have been especially heavily affected by the virus, African American communities, Hispanic communities as well. What more are we learning on that front?
Yeah, Kiko, unfortunately, you're right. We are heading to a very, poor number when it comes to being able to control this. And this comes at a time when we're battling the idea of testing versus what that means for the country. Are we in fact testing enough, and are we finding these cases in time? So as we know already, New York is getting hit pretty hard, but what does that mean for the rest of the country? We're starting to see those major metro areas really pop up with cases. We know that Detroit is also a major center, Chicago as well. And so looking at that, we've also been able to identify that the minority communities have in fact been disproportionately affected. We've seen that while African Americans make up, say, 13% of the population, 33% of them have been affected by death. And so that's coming from a report from the CDC, which is limited in scope, but it does give us a preview. And we're hearing anecdotally, as well as through records from states that are in fact tracking this. And so it touches on a point that was pretty relevant actually before the outbreak, which is that social determinants of health do in fact affect the ability for different communities to access health and to get the treatments that they need. And that's coming to light here. And I've heard a number of health experts say, while the president and while Governor Cuomo and others are saying, oh, this is really perplexing, we have to figure out why it is, they're saying we already know why it is. And it should have been addressed beforehand with things like mobile testing sites and making sure that there was in fact access and more attention paid to African Americans and Latinos in terms of testing. So as we know, there was already a shortage and already, a limit on who was being tested, but more attention should have been paid there. So we'll see how this pans out and whether or not, the coming weeks do in fact show a continued trend line there. But we're waiting to see on that, Akiko.
Yeah, no question. One of the things we've learned throughout the last several weeks is just how glaring those inequities are and how that's likely to increase on the back of all of this. I'm curious, you talked about the availability of testing, and now that we know that some of these communities are more heavily affected than others, have we heard from sort of local governments about whether they're likely to shift the testing, or, is this really just about availability overall?
We do know that Governor Cuomo today did in fact say that there will be attention paid to that and more testing done for African Americans. And we're waiting to see how other states as well respond. We know that a number of them are paying attention and tracking closely. So while we do know that there is still a limit in terms of who does get approved for testing, we're hoping to see that number does increase when it comes to these minority populations.
And, Anjalee, I was talking to a doctor in New York City just the other night, and she was telling me, some good news potentially, which is that the ERs there are starting to get a little bit more quiet, which maybe points to the flattening of the curve. Another thing she told me, which I wasn't really aware of, was the death toll numbers that you see, which are so horrifying, but that they only reflect the deaths that are in hospitals. So
correct.
Actually people who are dying at home, and I don't know if we have any idea of what percentage, say if you've got 5,000 people who've died, well, are there X thousand more who died at home or aren't even counted, right?
Right. So there has been debate about that. And I know that the White House task force has in fact heard some of these anecdotes as well, and whether or not funeral homes are in fact reporting these cases out. We know that it's a really tumultuous time with so much information, coming at them. So it does remain to be seen whether or not they're counted, in which states they might have already been counted or not. But there have been concerns about over or under reporting. And that is generally true, just as we're talking about testing, over or under reporting on whether or not these cases that exist are actually counted. So the numbers, while we watch them closely and continue to track them, as I've said before, epidemiologists use them as sort of a gauge of where the virus is spreading rather than an actual factual number.